Well, the only thing I can say, Jim, is that transitions are important, and if you don't have a smooth transition, you would not optimize whatever efforts you're doing right now. As you know, Jim, I've had the opportunity to serve 6 administrations, which amounted to 5 transitions. So I have been involved as a health person in the transition, and it is really quite important. As I used the metaphor the other day, it's kind of like a relay race in which you're passing the baton, and you don't want to slow down what you're doing, but you want the person to whom you're giving the baton to be running with it as opposed to stopping and starting all over again. And that's the reason why it's important in every level to have a smooth transition. Well, first of all, you can talk about things like what is the level of supply that's available? What is the utilization of PPEs? What about the hospital beds that the various members of the current coronavirus task force are in communication with the health groups in different states, getting interaction at a formal level with the governors, understanding every detail of the vaccine program, not only the 2 vaccines that have fortunately been shown to be very effective, but where are we in Operation Warp Speed with regard to the other candidates which are coming into their own in the sense of clinical trial, accumulating data. All of those things can be done in partnership. Yeah, of course they would. As I mentioned, I can recall in the transition that we had from the Obama administration to the Trump administration, that then Chief of Staff Dennis McDonough worked with Reince Priebus and brought several of us together to talk about how we had handled Ebola, how we had handled Zika, to give them an idea of the kinds of things that you need to do. I mean, it's easy to hear about it in the news and to read about it, but when you sit down with somebody and talk about what went wrong, what went right, that's important. Well, they are going to go up, Jim, and that's the reason why I keep, almost pleading with the American public that clearly we're not going to have a national shutdown, but we need to intensify common, easy to do, relatively speaking, public health measures that are not shutting down the country, not shutting down the economy. The uniform wearing of masks, let's get it straight. They work, use them. The next is avoiding congregate settings, particularly indoor, keeping distance that we talk about. To the extent possible, doing things outdoors, preferentially to indoors, and washing your hands frequently. We've got to get that point across. Vaccines are important, but the important issue is that we don't want the extraordinary success of these 2 vaccines to get people to be complacent. I've often said help is on the way, but help is not here yet. So one of the things we need to do is to use the success of the vaccines to get people to be motivated to hang in there a bit longer and double down on the public health measures without necessarily shutting down the country. You can continue to do activities which are good for the economy, but still adhering to the public health measures that we're talking about. I just can't understand why there's pushback against that. They're not that difficult to do. And they save lives, Jim. They save lives.